like me to address you?
As Emily.
All right, Emily. I'm Tiffany. I'm here to conduct your quick assessment, 30 minutes. Is it okay if I do your assessment?
Yes.
Okay. I'm just gonna wash my hands. And the first thing we're gonna do is gonna look at your skin and just look at your skin of your arms and your legs.
Okay.
Can we lift these up a little bit?
Yep.
So we're just gonna look at your skin. We're looking for any kind of moles or anything here. And then we'll look at your legs. All right. Then what we're gonna do is we're gonna come over here and we're gonna take a look at your hair and just inspect your hair distribution, okay? Then we're gonna just look at your neck all the way around. And then we're gonna palpate your temporal arteries over here and just feel for a pulse. And then what I'm gonna do is I'm gonna grab my stethoscope, take a listen as well. Okay. After that, we're gonna, oh sorry. And then after that, we're just gonna palpate your frontal and maxillary sinuses. Tell me if it hurts anywhere.
No pain.
No pain, very good. Any pain anywhere else?
No.
No, okay. And then what we're gonna do is we're gonna go behind you and we're gonna feel for your TMJ jaw, or of your jaw. We're gonna have you open and close it. Ready? Open, close, open, and close. All right, next we're gonna palpate all of your lymph nodes, okay? So we're gonna go here, in the back. Okay, and nothing is going up. Nothing is swollen. We're gonna go right underneath your arm over here. Okay, and then underneath that arm, sorry. Okay?
Yeah.
Okay. All right. So now that we've palpated all of that, of your lymph nodes, we've gone under your jaw, we've done the clavicle, the axillary. I'm gonna go behind, we're gonna palpate your thyroid. Okay? Okay, can you swallow? Okay. Next, we're gonna palpate each carotid artery on each side first. We're gonna go to the left. Okay, we're gonna go to the right. Then I'm gonna grab my stethoscope and we're gonna actually listen for a bruit in the throat. Sounds good. Now we're gonna do the left side. Okay. Okay. Next, what we're gonna do is we're gonna inspect the external eye, looking for anything, and then we're gonna look at your eyelids with you closing your eyelids,
Okay.
your eyes, okay?
So
So we're just gonna look, yep, inspect both sides. Okay, can you close your eyes? We're just gonna inspect the upper and lower eyelids. Okay. Next, we're gonna have to dim the lights to get some of the, actually we're gonna do the extraocular movements first, okay? So, looking straight at me, I'm gonna have you look all the way to the right. Okay, look up, look down. Now we're gonna look all the way to the left, look up, and then look down left. Now we're gonna do the test your peripheral vision. So covering your left eye, here we go. Just tell me what number you see.
1,
2.
Oh, sorry.
No, keep that eye closed. Yep,
Oh.
there you go. You ready?
1, 2.
All right, now switch eyes. There we go. Ready, and
1, 2. Sorry. 1.
all right, ready, keep it closed.
1, 2.
There you go. Yep. Now we're gonna darken the room so that we can check your reflexes. We'll go from there, okay?
Okay.
I'm worried though. Are you gonna be able to still see? Okay. here we go. So the first thing we're gonna do is I'm gonna look inside your eyes. Okay, we're gonna examine both eyes. You're just gonna look straight ahead, okay? Here we go. Okay, gonna look at the other eye, blink, blink, blink. Oh, good job. Okay. So, both eyes look good. They have nice disc margins, sharp disc margins, no hemorrhages, and they also have no exudates. I didn't see any intraocular narrowing. Next, we're going to do is, we don't have an eye chart, so what we're going to do is, if we did, we would put the patient 20 feet away. I'd have you cover one of your eyes, and what I would do is have you read the smallest line that you could possible. Okay, but because we don't have that, we would cover your other eye, and we'd have you do the other eye as well. But because we don't have that, we won't do that. All right, next, we're gonna look inside your ears. Gonna take a peek. We'll look inside this right eardrum first. We're actually gonna inspect your ear first, and then we'll look inside. So just looking at both ears. Look good. And then what we're gonna do is I'm just gonna take a peek inside your ear and just to take a look inside. Ready? That side looks good. Looks good. So inside both ears, there is nice pearly gray white with positive light reflexing off of your eardrum, so that's good. We'll turn the light back on. Watch your eyeballs, sorry about that. Whew, sorry. And now what we're gonna do is I'm gonna stand 2 feet behind you, you're gonna stand straight ahead, and I'm gonna whisper something to you, and I'm gonna have you repeat it, okay?
Okay. E. 3B.
Okay. Actually, cover this ear real quick. Let's try that again. Okay, you ready?
K. 8B.
Okay. Now let's try this side. I'm gonna have you cover that one.
T3M.
Very good. Nice job. Just looking to see if you can hear that okay. Next, we're gonna grab our tuning fork. The first thing we're gonna do is the Rinny test, and you're gonna tell me which is louder with the fork, which is louder for you, okay? I'm gonna bang it, and you're gonna look straight ahead, okay? If you do, just tell me if you hear the sound. You ready?
Mm-hmm.
You can hear it over there?
Yep.
Okay. Let's see if you can hear it over here.
Mm-hmm.
Ready? No time.
Yes.
Okay, let's try this one.
Yes.
Okay. And then now we're gonna do a Weber test, which is if you can hear this sound bilaterally. You ready?
Okay. Yeah.
You can hear both sides? Okay. Good job. Next, we're just gonna take the otoscope and look into your ears, both sides, okay?
Okay.
Look at your nose. Here we go. Nice and clear. Nice and clear. Nice job. Okay. Now I'm gonna give you something to smell. If you can just close your eyes
Okay.
and tell me what you smell. You ready?
Mm-hmm.
Okay, here it comes.
Smells like a alcohol pad.
Yep, it does. Okay, now I'm gonna have you cover this side and breathe in and out. Okay, so that's good. Now cover that side. All right, good job. So So now we're gonna open your mouth and I'm gonna have you move your tongue in the direction I tell you. Okay, open your mouth, ready, up, down, left, right. Now, if we were gonna test your gag reflex, we would grab one of these and have you stick out your tongue and we go back until it gagged you, but we're not gonna do that today, okay?
Thank you.
So that's that. Next, I'm just gonna have you open your mouth and I'm gonna look all around and just see if it's nice and pink, which it is, so thank you, nice job. Next, what we're gonna do is I'm gonna have you lay back a little bit and we're just gonna look at your neck for pulsation. JVD is what I call it. Sorry about that. Okay. There we go. All right. Okay, so next we're gonna look at all of your pulses. Okay, so we're gonna look at an epical, and then I'm gonna have you lay on your left side, and then we're gonna, while we do that, and then I'm gonna check all your other pulses, okay? So if you can lay on your left side here, I can go all the way back down if you want.
Oh, thanks.
Okay. And we're just gonna feel for your pulse right here. Okay. And then we'll come sit back up. I'll bring it back up for you. Tell me that's comfortable. Is that comfortable for you? Okay. You can lay back. It's okay. That's comfortable for you. Okay. And then we're gonna check brachial pulses here. Feel for carotid, one at a time. Okay. We're probably gonna have to lay back though for this next one.
Okay.
Okay. Tell me if that's comfortable for you. Does that feel good?
Yeah.
We're just gonna feel for our femoral pulse here. We're gonna go back here. I'm gonna feel for a popliteal. Sorry, mine. All right, let's feel this one. You can just rest it down.
Oh, sorry.
Okay, now we're gonna feel for our posterior tibial. Okay, this one. Alrighty, now we're gonna feel for these ones down here on your feet. Good ones. Okay, now if you say just like that, I can listen to your heart. Okay, we're gonna listen to your heart. I'm gonna listen to it on all sides, all 5 different parts, with the diaphragm part and none the bell part.
Okay.
Okay. All right, here we go. All right, here we go. Or listen to it again, same thing, okay? Okay. Now we're gonna listen to different arteries, but you can stay right there. I won't lift up this. We're gonna listen for a renal artery. And then we're gonna listen to the iliac. We're gonna listen to the aorta. And then we're just gonna listen to the femoral artery right here again. we'll sit up a little bit. I can move that up again for you.
Oh, it's okay.
There you go. And now we're just gonna check for capillary refill on your fingers and on your toes. And there we go. Very nice. Okay. Okay, and then what we're gonna do is we're gonna check for firmness. So I'm gonna have you say 99, okay?
Okay.
Here we go. Are ready? Nice. You say 99.
99. 99. 99. 99.
Good job. And then what I'm gonna do is I'm gonna come behind you a little bit,
Okay.
and we're just gonna check and make sure that you have good expansion. Okay. So
Okay.
we're gonna go right over here, and can you just move up a little bit just so I can get to? There you go. All right. Go ahead. Nice deep breath. Just making sure that the chest expansion was symmetrical, which it is. And then if we had a pulse oximeter, what we would do, make sure you didn't have nail polish on, we would put it on your finger and we would read your pulse oximetry, but we don't have one of those right now. Okay?
Okay.
Now what we'll do is we'll percuss. So I'm just gonna be listening to different spots as we go down your body, okay? We'll do 6 in the front and we'll do 10 in the back, and then we'll listen to everything, okay? Here we go. So we're just listening, making sure that there's no sounds we shouldn't hear. Okay, now we're gonna go to the back, and we'll just go right down, okay? Okay. So now we're just gonna listen now to the same spots. Just take a deep breath, okay?
Okay.
When I move her. Here we go. Good job. Nice and slow. Good job. Good job. And I'm just gonna listen right over here. Nice deep breath. Good job. Okay. Now we're just gonna do the same thing just in the back, okay? Here we go. Oops, sorry. There you go. Nice and easy. Good job. All right. So now we're just gonna do an abdominal assessment. So what I'll do is I'm just gonna lay this back, okay? Here we go. You can lay all the way back. There you go. So what we would do first is we would lift your shirt up and we would look at your belly, at your abdomen, and inspect everything here, but we're not gonna do that. But we would look for anything that we could find. So then I'm gonna listen to your stomach. We're gonna listen for bowel sounds. So we're gonna start down here. Go up. Go here, the left upper quadrant. Okay. Now what we're gonna do is we're just gonna percuss in those areas, just like we did in your chest, remember? Okay. And then now we're just gonna palpate it here. We're not gonna go too deep. We're just gonna try to feel for things. Your liver and your spleen, your kidneys. If we were gonna go deep, we would palpate all the way down into your liver, push in deep, push in, go over here, try to find your spleen, push in each of the 4 quadrants, but we're not gonna do that. Okay, now what we're gonna do is we're gonna have you sit up, okay? And then what we'll do is I'm gonna come back here and we're gonna I'm gonna hit here and you tell me if you feel any tenderness on your kidney, okay? Anything?
No.
Okay, perfect. Let's move this table back for you. So now we're gonna do some standing up stuff here, okay?
Okay.
We'll just stand here. So what we're gonna do is I'm gonna just inspect shoulder joints, just looking for any kind of swelling. We're gonna check your elbows. We'll look at your wrists and fingers. And your spine. And then your hips, and anything there. And then we'll look at your ankles and your toes. So using your neck, we're just gonna do some range of motion, okay?
Okay.
So we'll go forward, move it back, side to side. There you go. Now ear to shoulder, ear to shoulder. Now I'm gonna have you push on me, just test your strength. Forward, test back, try to go side to side. This side, this side. There you go. Now we'll do shoulder range of motion. So we'll test flexion going forward, extension going backwards, and then bring your arm right across your body to do adduction. And then what I'm gonna have you do is you're gonna go against me, do a shoulder shrug. There you go, good, there you go. So now we're gonna do your arms. So pushing up, I'm gonna have you go against me, try to go up, now go back, there you go. This is just testing for strength. Now we're gonna do elbows, okay, range of motion. So we're gonna do flexion, extension, pronation, and supination. So can you bend your elbows? Can you straighten them? Can you turn your palms up like you're carrying a bowl of soup? Now turn them down. There you go. So now we're gonna check your hands and wrists, okay? For the same thing, flexion, extension. So with your palms down, can you point your fingers to the floor? Okay, with your palms down, can you put your fingers up towards the ceiling? Very good. There you go, go up. There you go. And then with your palms down, bring your fingers together, all the way together. And with your palms down, spread them out. Spread your fingers out. Okay. So we're gonna, with your wrists, try to go up, try to go down, and then can you squeeze my hands both sides? Good job. Now we'll look at your spine for range of motion, okay? We'll do flexion, extension, lateral bend, and rotation, okay? So can you touch your toes? There you go. Now come back up. Can you bend your back all as back as you can go? Good job. Now we're gonna have you go from side to side. There you go. Now we're gonna come check this side. And go side to side. There you go. Good job. Okay. And then can you bend from side to side? There you go. Very good. Now we'll check your hips range of motion, flexion, extension, adduction, and abduction, okay? So we'll have you go on your back for this one, okay? We'll bring the table back down, just go all the way back down. So while on your back, okay, we're gonna lift each knee towards your abdomen, one at a time. So can you bring this one up towards you? There you go. Can you do your other one? Okay. Now can you move your leg across your body, like away from your body? There you go. How about this side? Let me move this for you. Oh, this one doesn't move down right now, sorry. There you go. Okay. So now you're gonna test your flexion, okay, with your legs across your body, and then while supporting your pelvis, okay, you're gonna try to bring this leg up all the way up against me. There you go. Now this one. There you go. Okay. Now ankles, if you can sit back up, what we're gonna do is point your toes towards the ceiling, point your toes down towards the floor. Okay. Heels go inward, heels going outward. Okay. Now while you're doing that, can you push my hands up against, there you go, my hands down. All right. Next we're gonna grab this, we're gonna test deep tendon strengths, okay? So here we go. We'll test your knee. Okay, we'll test this knee. I'm gonna test this one here. Test that one. And now we're just gonna test behind your ankle here, your Achilles. Okay. Now we're just going to check some other little cranial nerves. Okay. Can you clench your teeth? Move your jaw side to side. Okay. Close your eyes. Can you feel, was it soft or is it sharp or is it soft?
Soft.
Okay. And then what about this one? Is it sharp or is it dull?
Sharp.
That one's sharp. Okay. Now you're just going to look straight ahead for me, just so I can test your corneal light reflex. Straight ahead. Look straight, straight, straight. There it is. Straight, straight, straight. There it is. Okay. Can you raise both of your eyebrows? Okay, there you go. Down. Can you frown? Can you close your eyes? Tight, tight, tight. And can you smile? Good job. Could you open your mouth and say ah and stick out your tongue?
Ah.
Nice job. Now running your heel, can you run it down your shin? There you go. Can you put your finger to your nose? Both of them, both sides. There you go. Can you get up and just walk a little bit across the room? Now do heel to toe. Can you walk on your toes? Can you walk on your heels? Okay. Now on your lap, can you do an alternating movement with your hands? Fast, fast, fast in the front. There you go. All right. So if you take a seat, just real quick for me, we're going to try to test the difference between dull and sharp. Okay. So you're going to feel dull and sharp. Okay. Ready? Close your eyes.
Dull. Sharp. Dull. Sharp.
There you go. Now tell me, using your fingers, am I going up or close your eyes? Am I going up or down?
Up. Down. Down.
There you go.
Up.
Okay. I'm going to draw a number in your hand. You tell me what number it is.
3.
There you go. Yes. One more thing. Close your eyes and tell me what this item is. Ready? Close your eyes.
A paperclip.
That's right. Okay. Can you tell me your name?
Emily Benoit.
And where are you?
We're in Brentwood, New Hampshire.
That's right. Do you know what time it is?
Like 5:36
Okay.
ish.
Yes. Good job. Now counting backwards from 100, can you count by sevens? And I'm going to time you for a minute.
Okay.
Ready? And almost there. Go ahead.
93, 86, 59, 52, 45. Oh, I missed a whole chunk of numbers.
That's okay. Just go back from 45.
45, 38, 31, oh my gosh, it's hard. Come on. I'm drawing a blank here. Oh, 26, 19, 12, 5, and we're at 0 because I missed a whole number.
That's okay. Thank you for doing that. Now I'm gonna give you a piece of paper. Can you do exactly what the instructions are? Ready? Read the instructions and just do what it says. Thank you. Do you remember how you celebrated your last birthday?
I went to Foxwoods.
You did, okay. And I'm gonna give you 4 words. I'm gonna tell you what they are, and then you're gonna count back from 20, and I'm gonna tell you the 4 words again.
Okay.
Okay? Happy, dog, Disney, and Christmas. So countdown, oh sorry, go ahead.
Happy, dog, Disney, Christmas.
Now count back from 20.
From 20?
Yep, count backwards.
19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Okay, what were the 4 words that I asked you to say?
Happy, dog, Disney, and Christmas.
That's right. Thank you so much for participating in this. You did a good job. I know some of those were hard. Thank you very much.